Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi, Dr. Darrow.
Hello, Nita Valens. How are you today on this gorgeous
I'm great.
day?
How are you?
Living it up as always. Got to be living it up. If you're not living it up, what are you doing?
I don't know. Maybe you're in chronic musculoskeletal pain. Oh, what a topic that could be.
Let's talk about that. How do we heal people, Nita?
We heal people with regenerative medicine.
Yes, that's
what does that mean? I'll let you say. You're the doctor.
Yeah, PRP, platelet-rich plasma, injections. We take your blood and spin it, or we can get your stem cells and inject those. And it's an amazing, amazing procedure that I've been doing for over 25 years. It's hard to believe I've done anything that long. It gets better and better. I learn new things almost every single day. It's amazing. A lot of this work has been intuitive for me. Back in the day when I started, there were really no classes or anything to be trained on this. So I was the guinea pig, and as everybody knows who listens to the show, Nita, you certainly know you had this done on your neck.
Yes, twice.
Twice different times, and we healed you up. And I've worked on my, the first thing was my right wrist, then my right shoulder, then my knees. What else have I done? I've done my elbows, my broken ribs on my back. I've used this every time I've been injured and being a little bit, what do they call people like me, Nita, in psychological terms that are hyperactive?
Well,
ADD?
hyper-aroused could be, a word.
I'm active, and I do sports pretty hard.
Well, you're high energy, that's all. I mean, it's not anything pathological.
I hope not. There's no medicine
It's just
for
you.
me. It's just me, exactly. But I've been very fortunate because the work I do is something I've been able to do on myself. And very fortunate because I don't know what I would have done sports-wise had I not known about this type of work. I was introduced to it during my residency at UCLA way back. And it's been working on me ever since. So I don't like getting injured, but I do like that I heal very quickly. Every single time I've used this on my body, I have healed. Sometimes it's been overnight. Sometimes it's taken several treatments. I don't know why that is. It's always the question that people ask me, how soon, doc, will I heal? How many treatments? I don't know. I have some individuals that come in with an MRI or an X-ray that shows nothing, and I think it's going to be easy to fix them, and it can take a while. And then vice versa. Most of the people that come in who've been to an orthopedic surgeon who are ready for surgery, we've healed without surgery, and their MRIs or their X-rays are abominable. And it looks terrible, but I've learned over the years not to really trust those images. So it's always a learning curve in medicine for all of us. We keep all of us docs and everybody, nurses, PTs, physician assistants, nurse practitioners, acupuncturists. I don't care what type of work you do in medicine. It's all good. I'm open-minded, and I think we all keep learning. We all try new things all the time and see how they go. Nita, would you mind me taking a question until we get callers? Actually, I'm going to give out the not the cell number. I'm going to give out the studio number.
Okay.
So we can get some callers in. That's a little fresher and more fun with the repartee that we get with people that call in.
Yes.
And you call about anything that's happened to you or is happening to you or your parents or friends, and you can use a fake name if you like and not be shy. Or, you know what, you can go to my website, too, and that's www.lastemcells.com. That's www.lastemcells.com. There's a spot on every page of my website which is humongous to email me, and I answer emails all day, all night long. But in the meantime, if you want to call now, and I hope you do, we have fun with our callers. The phone number to the studio is 866-870-5752, 866-870-5752. I'm wondering, I played golf with a new guy yesterday. Well, a couple of people I've played before. They brought along a guy named Larry. I don't know if Larry's listening. He said he was going to call in. I gave him the number, and he said he has a memory where he remembers everything. Let's see if he remembers the phone number I told him. We'll see. I said, how do you remember everything? He said, well, phone numbers, I do it backwards. And I go,
that's hilarious.
Yeah, everybody's got their way.
Yes.
I do see a call coming in. I wonder
Okay,
if
but I just want to make sure people realize that when they call the show today, they get your latest book for free.
Yes, it's Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's a couple hundred pages of studies. There's about 250 studies which show why, how, and the scientific basis of regenerative medicine of platelets and stem cells and prolotherapy. Actually also has, I'm looking at it now, has a chapter on PRP and hair growth, and the vampire facelift, which is injecting the face to stimulate new collagen growth, make people look younger again. And the hair can grow back on top of the head also. Oh, here's Steve. Let's go to Steve. Thank you for calling in, Steve. This is Dr. Marc Darrow. You have left knee issues. Oh, you're a former patient of mine. I hope that's good news.
A very happy former patient. A couple of years ago, you did work on my shoulder. I had tears in labrum, bicep, and rotator, and I had 3 treatments of stem cells and PRP.
Okay.
And then I ended up going ahead and having the orthopedic surgery because it had gone about as far as it could go with the treatments. And my surgeon was thrilled with the fact that even though he told me it would be 6 to 9 months before I'd be playing golf again, I was out in 3, and everything was going great. So,
well, why don't you meet me on the course later today? Show me your stuff.
I will, except my knee is so messed up, I'm having a hard time turning. You play at Mountain Gate, I play at Braemar, so we're neighbors.
Yeah, well, anyway, I'll take you to Mountain Gate, you take me to Braemar.
Fine, sounds good to me. Anyway, so I'm just turning 70, and like you, I'm very active. I play golf 3 times a week, and I like to be competitive. About 6 months ago, my left knee started hurting.
Okay.
And I couldn't actually bend down to sight a putt, and I knew something was going on, but I just tried treating it with the typical anti-inflammatories, meloxicam, Advil, and such. And it's not gotten any better. I went to my doctor and got an MRI, and he came back with moderate arthritis, which he said didn't surprise him in somebody my age.
Sure.
Fluid. It was called
an effusion,
diffusion fluid with a Baker's cyst.
Right.
A grade 1 MCL sprain without a tear. Paraligamentous edema.
Okay.
And
what's that first word? Peri what?
Paraligamentous.
Oh, edematous. Yeah.
Okay. Whatever. Sounds good when you say
it. Just means it means it's not fluid. That part is just the tissue is swollen. Yeah.
Okay.
Not a big deal.
So anyway, my doctor says, there's no surgery to be done for this. There's a mild tear somewhere, but he said it was not enough to be causing the issues I'm having. And they go right to, let's just start injecting you with cortisone.
Okay.
And I'm a little reluctant with cortisone because I understand you're not supposed to do it that often. He's talking about, we'll try it, and in 6 months, if it works, great, we may have to do it again, and who knows, maybe we'll do it every 3 months after that. And I'm thinking to myself, this doesn't sound right to me.
I would go to your computer right now, and all of you other people listening also, and just Google cortisone and then cartilage, those 2 words, and you'll never get a cortisone shot because
I know, that's why I'm calling.
It destroys the steroid destroys the cartilage.
Yeah.
And you get away with doing it once or twice, but that's getting away with it. It's not really good for it, and it's not at all good for it, to be honest with you. And that can cause meniscal tears and all kinds of other things. So I wouldn't do it. And the way to do it in my book, as you know, is to inject it with something that's going to grow the tissue back and regenerate it. The MCL sprain is absolutely nothing. That's something that people get all the time. That's in the middle or the medial part of the knee, is the medial collateral ligament.
Okay.
So if that's where, is that where the pain is, in the middle part of the knee?
Actually, the pain is at the back of the knee on the left side, and
so
I
that could be
rotation from the golf swing.
It could be, for sure. And it also could be, it depends how big that Baker cyst is. When you come in, I will look immediately with the ultrasound to look inside and see how big that cyst is. Some of them are so small that there's nothing to do about them, and some are so big. Yeah, it'd be wonderful to just take them out. We do it under ultrasound guidance, so we stay away from the popliteal artery and nerve and all of that. Don't ever get a shot in your knee without ultrasound guidance, because it can be very dangerous. I'm concerned about that
as well. I know when you were doing the treatments on me, you definitely had the ultrasound, and you were...
Well, you want to know where the needle's going, not guessing where it's going.
Yeah, especially if they're going to shoot me with cortisone.
Well, it doesn't matter. You just don't want a needle going in the wrong place.
Yeah.
But you're right. Yes, you want it to go in the right place. And it's so interesting because many years ago, before we had ultrasound guidance, we were wondering why certain areas of the body didn't get better with treatment, one of them being the hip. The hip joint is real teeny. The shoulder joint is real teeny. The knee joint, there's ways of getting into it that are a little easier, but even so, it's been found that at least 1/3 of the shots into the knee that are done without guidance, we call that blind injections, do not even get into the joint. So once we had ultrasound, all of a sudden people were healing much better, and we're like, whoa, well, the reason was we weren't doing it right. So ultrasound's been amazing, and I love doing it. The nice thing also is you can watch on the screen and see what's happening. You can watch that needle going in and taking out that effusion. You'll see the fluid just go away. And if there's a Baker cyst, you'll see that disappear also.
Will this help? I mean, I know when we did stem cells on my shoulder, the inflammation came down quite a bit, which I think was part of why I was having the impingements I was. Will that work the same way on the knee?
It should. I mean, there's no promises in medicine. Everyone says, tell me what's going to happen. I want a guarantee. And I go, sign this document that says there's no guarantees, please. There's no guarantees with anything in medicine. I've seen people take a pill and die.
Yeah.
You know, surgery, I've seen people die, get infected, you name it. So we never know what's going to happen. We just have a lot of experience and go on our experience as doctors to tell patients what we hope is going to happen. But there's no guarantees. But yes, it should heal your knee up. Your knee is not that bad anyway. It sounds like you can bend it and get around. And are you still playing golf, but it hurts?
Yes.
Okay, so your knee is probably fine. Okay?
Okay. Yeah, I mean, I'm finding that I'm not able to rotate as much as usual. I think on my follow-through, I'm a little afraid of
tweaking it.
Torquing it too much, I tend to back off a little bit, which is not my normal style. Should the Baker cyst be drained?
It depends how big it is. If it's big, I'd drain it at the same time that I injected the front of the knee and aspirated the front of the knee.
And would this be stem cells or the PRP?
Well, we'll take a look at you, see how bad it is. Or how good it is, I should say.
Yeah. Okay. All right. Well, good to know.
God bless you, Steve. I appreciate your call. We're going to go to Larry, who I did play golf with yesterday. Larry, Dr. Marc Darrow, how are you today?
Well, doing okay. I'm actually at the range right now.
I'm jealous. You don't give up, do you? So I just want to give Larry a pitch. Larry is the originator of the 61 Club, which is a nonprofit organization that helps disadvantaged kids get on the golf course where they wouldn't have the money to do it. And Larry, how long have you been doing that?
Well, it's interesting. We started a long time ago, but the project that we're currently working on out in San Bernardino that's gaining a lot of traction started about 7 years ago in partnership with the school district. So we're just working to change the way people think about golf, especially young people.
Yeah.
With limited access to the golf course.
Sure. It's a great, great game for youngsters. It keeps them off the streets. It keeps them off of drugs. I've never seen, this is me personally, I'm not saying it's the way it is, but you don't usually see kids doing drugs who play golf. It's...
Yeah.
Do you find that also
I'm sorry.
Do you find that it helps straighten out these youngsters when they start playing golf? It's a real clean sport. It's like swimming or something.
Yeah. What's interesting about golf and just the whole golf environment is, golf at its core is a game of honor, right? So
yes,
it takes all kind to fill the freeway, like a good friend of mine, Tom Rubidoux, said back in the old days. So there's all kinds of golfers, but generally speaking, the environment, the golf course environment, is an environment of respect, and so the more you can get kids into that environment, the better. And then over time, the fundamental lesson we teach them is that there are no referees or umpires on the golf course. You're responsible for what happens.
That's true.
And over time, that starts to seep into just everything that they do. Now, we fight against the fact that all their friends and most people in the community think golf is whatever, right? Like all the myths. It's not for them. It's only for rich people. It's lame. It's too boring. All those things. And I always tell the kids that anyone that says golf is boring, it's just because they're probably not good at it and they don't know how to play.
Well, that's correct. It's not the kind of thing where you just go out and you're amazing in 1 minute. It does take some training. The golf swing is, honestly, it's a very difficult swing. To me, it's like, I call it similar to ballet. There's moves to it to get a nice swing and to be able to hit the ball where you want it to go. To me, it's magical and mystical because there's so many things you can do with that golf ball that you can't believe. And I actually hit a hole-in-one by slicing the ball into the woods. It hit a tree, and I'm looking in the woods, and the guys on the green that get to the green go, "Hey, Mark, your ball's in the hole."
Right.
And then there's shots that should go in the hole that end up in the trees, and it's the most beautiful walk you can take. I think it's just a really fun time, and you're with buddies, you make friends. Even like you and I never met before, but we were like best friends by the end of the game. And I just wanted to thank you for calling. We have other callers, Larry, so I appreciate it. Do you want to give out your phone number in case people are interested in this?
Sure. I mean, they could go to 61golf.com. That's 61golf.com, and they could just say, "Hey, I heard about you guys on Dr. Darrow's show," or they can call 888-272-1078, and they can reach us there.
All right, man. I really appreciate your call. But wait a minute. I think you mentioned you had a knee problem, didn't you, on the golf course?
Well, yeah. I think I heard you talking about the meniscus.
Yeah.
And I think that's probably what it is because it's something that I think I did a long time ago, and it's right in the middle of the knee.
Okay.
And I get around just fine, but every now and then if I torque it or get it at an angle, it feels like somebody's sticking a knife in my knee.
Well, what I'm going to do for you, since you're a good man doing good things for people, come in and I'll take care of you for free. How's that?
Well, that's so cool.
All right, man. God bless you. You live it up. We're going to go to Andy after I give out the phone number to call the studio. And the number to call us and talk to us live right now is 866-870-5752. If you call in, I'm going to give you a copy of the book that I have in my hand, which is all about healing. It's all about regenerative medicine, how to heal your musculoskeletal pain with stem cells and platelets rather than doing a surgery that you don't need to do. And I'm just telling you, people, I get way too many patients who come in that had a failed surgery, didn't work, they never should have done it, and they're worse off, and we can still get them healed up. Not always, but most of the time, by using PRP, platelet-rich plasma, and stem cells. So, Andy, this is Dr. Marc Darrow. You have a knee issue also. Today is knee day so far. What's going on?
Yeah, no, thanks for taking the call. My father-in-law, Dennis, turned me on to you, and we were talking about a shoulder issue he had, and I was talking about my knee. And I've had a little bit of a recurring knee issue for about a year and a half now. And previously, I got an injection of a product called, I think it was an exosome biologic product.
Okay.
By a manufacturer called Direct Biologics, and it really did a great job. And I didn't know if you'd heard of that product or if you have any thoughts on it.
Yeah, I do. Exosomes are fine, but when we inject you with stem cells, there's exosomes in it, so you're getting more of a benefit than just exosomes
so
alone.
What's the difference?
Well, the difference is exosomes don't have stem cells in them. Or platelets. So it's like, let me think of an analogy. What kind of work do you do?
Oh, I have an office job. I'm in the computer business.
Okay, computers. Okay. So if you have a job that takes 10 people to do, that you need 10 computers and 10 people to get the job done in a day, and you have one computer and you're going to do it alone, and you'll get 1/10 of the job done. Would you want to do it your way, or you want to do it with all 10 ways?
Got it. Interesting.
Yeah, so exosomes are fine, but they're just one piece of the puzzle, and you get that when you do stem cells, okay? You get a lot of different healing factors with the stem cells that you do not get with just exosomes. I'm all for exosomes. I'm not putting them down. It's a great thing, but it's just not as complete.
How much more effective would you say the stem cells are compared to the exosome product?
I don't know of any study
Is it
that
10 times?
I don't know of any study that compares them, so I wouldn't want to jump the gun making up a story that I don't know the answer to. I just wouldn't do exosomes.
I was just curious.
Personally. Yeah. I personally wouldn't waste my time.
Great.
But look, there's a lot of exosomes being injected all day long all over the world, so I'm not against it. It's just personally I wouldn't do it, because every time you get injected, it's a little bit of traumatic experience for the patient. It's not a big deal, but why not get the job done quick, right?
Yeah, makes sense.
And, well, there's a lot more we could talk about. You can get a hold of me through the website at www.lastemcells.com, Andy, if you want to. Now, you said your father-in-law had a shoulder problem. What happened with him?
I think it was through just some working out. He got some bone spurs, and I guess because of the muscle was rubbing on the bone. I'm not sure much more than that, but
sure.
That was something that he and I were talking about. We were kind of complaining about.
Okay.
Body aches.
Has he had any treatment for it?
I believe he has, actually.
Is he all better? Did he get a surgery? What happened?
He did not do surgery, I don't think. I think he did some physical therapy, and that seemed to work.
Good. I always tell people when they ask, when people come in, they go, what should I do? I do the most conservative thing you can do. If it's physical therapy, great. If it's massage, great. Whatever it is that's conservative, do it first. See if that works. And surgery's at the other end of that, that paradigm, which is extremely invasive with, potentially terrible side effects that I've seen. And I always say, once the knife goes in, it doesn't come out. The damage can be done. I'm not saying surgery ruins everybody. It doesn't. It helps a lot of people. But I've seen, I'd say probably 50% of the cases that I see, the surgeries come out bad. Maybe not right away, but down the road a while. Let's say you take out some meniscal tissue in the knee. You're waiting for another surgery because the knees are going to probably be injured again. Shoulders with rotator cuff tears, same thing anywhere in the body. So I tend to stay away from surgery. That's the last option. And if physical therapy worked on your father-in-law's shoulder, God bless him. I'm glad that happened. I inject all over the body, and not just the major joints, but muscle tears and tendons and ligaments, and you name it, from head to foot. There's the break. Hang with us, Andy. We'll get right back to you. This is Dr. Marc Darrow, Living Pain-Free, Regenerative Medicine. Call us right now. You get a free copy of my book. Number is 866-870-5752.
Okay, and grab a pen or a pencil, write down this information coming your way. I'm Nita Valens, your host. We'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.